Hi guys, so this week we're going to talk about narcotic abuse. Hi guys, so this week we're going to talk about opioid abuse or narcotic abuse. So narcotics are also called opioids, and some of the drugs that are considered opioids are morphine, percocet, norco, Vicodin. Heroin is also an opioid, but it's an illegal opioid. All the other ones are prescription medications basically, and sometimes a doctor can prescribe these. If someone has had surgery, for example, if someone has had dental work, or if someone has had an injury where there's a lot of pain. So opioid use disorder is basically opioid addiction. Some of the symptoms are craving the drug, taking medication that wasn't prescribed to you, or using more medication than was actually prescribed. Most people don't become addicted to it. Those who actually become addicted will start finding ways to get a hold of the medication. They'll start doctor shopping, we call it, when people go to different doctors until they find the one that will prescribe the medication that they want. So the problem with having this drug addiction is that people overdose on opiates all the time. It can cause breathing to become so slow that they stop breathing basically, and it causes death. There's a certain medication called naloxone or Narcan, and it's available over the counter in some states actually, and it's available as a nasal spray. And this will immediately, fast enough, will reverse the effects of the opioid. Sometimes opioid use will lead to use of other drugs, or IV heroin use, or IV narcotic use, and sharing of needles will lead to the risk of HIV or hepatitis. So for pregnant patients, we usually prescribe for pain Tylenol under the supervision of a physician. And when you're only taking what you're supposed to and your doctor has recommended, it is safe to use overall. But you absolutely have to keep seeing your doctor to determine if, when you should stop, or if you shouldn't be taking it anymore, and only, be taking it under the guidance of your doctor. The problem with using opioids during pregnancy, like more than you're supposed to or illegally, is that when you go through withdrawal symptoms, the baby does as well. And this can cause, and actually the actual use of the drug can also cause problems like placental abruption, when the placenta separates from the uterus before the baby's born, growth problems for the baby, preterm labor, or death of the baby inside. And also, again, the lifestyles that are associated with drug use, like not eating well, then the baby won't gain weight normally, or missing prenatal care appointments, and then you miss tests for the baby, etc. And the risk to the baby of using opioids during pregnancy is that when the baby is born, the baby will no longer be getting the narcotic either. So the baby goes through withdrawal symptoms, or shaking, tremors, they won't feed well, they don't suckle well, they can have fever, diarrhea, vomiting, sleep problems. Not all babies will have this syndrome. It just depends on how much was used during pregnancy. So the way we treat opioid disorder in pregnancy and outside of pregnancy is to use certain long-acting opioids that make the cravings go away, but they don't really cause the high effect of the drug. So make sure you like the video, subscribe to the channel, and like us on Facebook, and follow us on Twitter. I'll see you next week.